some intersection somewhere for a motor vehicle versus pedestrian, okay? When we do this, keep in mind that you have to be very careful about your chief complaint, and you must ask for an apparent life threat or you will fail. Does that make sense to everybody? I test this one, so be careful. All right, so scene safety standard precautions. My number of patients is 1. It looks to be a mechanism of injury, so I'm going to be doing a trauma assessment. I'm also going to say that I'm going to go ahead and call ALS, and I'm going to go ahead and say that I need to do backboarding and take C-spine precautions. Invisible partner number 1, could you please hold C-spines? Do not remove your hands until I direct you to do so. My general impression is I have a young adult female between 20 and mid-20s who looks to be unstable. I'm going to go ahead and approach my patient. I'm going to go ahead and check. Ma'am, can you hear me? Ma'am, can you hear me? I'm going to do a trap squeeze. She responds to pain. She's a P on the AVPU. I'm also going to give her a 5 for GCS because she gets a 1 for eyes. She also gets a 1 because they don't open spontaneously. She also gets a 1 for verbal because she has no verbal. And she has flexion to corticate, so she's going to get a 3 for GCS of 5. Accepted?
Accepted.
All right. Here I'm also going to say that her chief complaint is altered mental status. Proctor, do I see any apparent life threats?
At this time, you do not.
I do not. Okay. I'm also going to say that she is a potential candidate for multi-system trauma. From here, I'm going to go ahead and look at airway, doing a jaw thrust, having my partner holding the head, opening the airway using the jaw thrust. And do I see anything?
You see blood and vomitus in the airway.
Okay, I'm going to go ahead and suction only on the way out for no longer than 15 seconds with a depth not to exceed the base of the tongue. Is the airway clear?
It's clear.
It's clear. Okay, I'm going to go ahead and protect the airway using a nasal pharyngeal airway, or NPA, because she might gag with an OPA because she responds to pain. Accepted?
Accepted.
Accepted. Okay, from here I'm going to go ahead and assess breathing. I'm looking at rate and tidal volume. I see fast and shallow. Is that correct?
That's correct.
Stop doing it. All right. So fast and shallow tidal volume, I'm going to say that's inadequate. I'm going to have another partner come in and positive pressure ventilate on 15 liters per minute, high flow oxygen. Patient accepted?
Accepts.
All right. Are there any other things that compromise breathing or respirations?
No.
No. Okay. From here, I'm going to go ahead and look at circulation. I'm going to do a quick blood sweep, hands on. Do I see anything?
Negative.
Nope.
Negative.
Anything? Nope.
Left forearm.
Left forearm. What do I see?
You see bright red arterial bleed.
Okay, so I'm going to go ahead and put pressure on it. Anything?
Pressure does not stop.
All right, I'm going to go ahead and have a partner throw on a tourniquet. Is bleeding controlled?
Bleeding is controlled.
All right. I'm going to continue my quick blood sweep. Anything?
Negative. 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 Negative.
Okay. After the blood sweep, I'm going to go ahead and check for a peripheral versus a central pulses, the radial and carotid. What do I find?
No pulse on the left radial and a weak rapid pulse.
Okay, absent at the peripheral and weak and rapid at the central. I'm going to say
Why do you
that's
guys think it's absent?
Because he put a tourniquet on.
There you go. Yep. Good.
all right. And I also have weak and rapid at the central pulse. From here, I'm also going to check for skins. What am I finding?
Pale, cool, diaphoretic.
Pale, cool, diaphoretic. All right, based on the pale, cool, diaphoretic, weak and rapid central pulse, as well as the possibility for severe blood loss, I'm going to say that I have a patient in shock. I'm going to go ahead and tell partner to grab blankets and heat up the ambulance to 85 degrees. Okay. From here, based on my GCS of 5, as pre-calculated, I'm going to go ahead and say I have a priority patient and I want to expedite transport. I'm going to go ahead and have another invisible partner find a bystander and try to get a sample history from anyone around who may know the victim. Accepted? Okay. I'm going to go ahead and start with my secondary head to toe. I'm going to start at the top of the head and I'm going to palpate. On visual inspection, I'm going to go ahead and look behind the ears for battle signs and around the eyes for paraorbital ecchymosis. I'm also going to look in the ears and the nose for any kind of CSF or bleeding. Do I find anything?
No crepitus on the back of her head.
Crepitus on the back of her head. Noted. I'm going to check the facial bones for structure and stability. Are they stable?
Stable.
All right. Nasal, stable.
Stable.
All right. Jaw, mandible.
Stable.
All right. I'm going to pretend to look in the eyes. My eyes are.
Let's just do pearl eye.
Decorticate? Okay.
Sure, let's do that.
Cool. All right. So I'm done with the head. I'm going to move on to the neck. I'm going to inspect the neck, palpating for a trachea. Is it midline or has it deviated? It's midline. I'm going to look for jugular veins. Are they distended or flat?
Flat.
Flat. Okay. I'm also going to palpate the back of the neck from the base of the skull. Flexion. Okay. Noted. I'm gonna go ahead and have a partner, go ahead and size and apply a cervical collar. From here, I'm gonna go ahead and inspect the shoulders, the clavicles, looking for subcutaneous emphysema.
Yeah.
Stable?
Stable.
All right. I'm gonna go ahead and push inwards and have a partner ventilate. Stable?
Stable.
I'm gonna blade the center of the sternum. Ventilate. Stable?
Stable.
I'm gonna go ahead and fan out from the xiphoid process. Put pressure and ventilate.
Stable.
All right. Are there anything else I see about visual inspection here?
Negative.
I'm gonna go ahead and auscultate second and third intercostal space, mid-clavicular bilateral, fourth, fifth, and sixth intercostal space, mid-axillary bilateral. Findings?
Clear bilaterally.
Clear bilaterally. Okay. So moving on from the chest, I'm gonna go ahead and inspect the abdomen. Do I see any pulsating masses, scarring, decap BTLS?
Negative.
Negative.
What is decap BTLS?
Deformities, contusions, abrasions, punctures, penetrations, protrusions, burns, tenderness, lacerations, or swelling. Any findings? None?
Negative.
Okay. From here, I'm gonna go ahead and there's the bottom, there's the top. I'm gonna go ahead and palpate all four quadrants. Anything?
Nope.
Nope? Okay. Moving on from the abdomen, I'm gonna make my way to the pelvis. I'm gonna go ahead and push in, down, and slightly out. Stable or unstable?
Okay, the pelvis is intact. You're stable.
Okay, stable. All right, for a female patient, I would inspect the perineum and place pressure on the pubis symphysis. And I would also, on a male, do a priprism suite. On male and female, I would look for any signs of incontinence, urination, defecation, or bleeding. Do I find anything?
Negative.
Negative. All right, I'm gonna move on to the legs. I'm gonna apply opposing traction on the long bone, joint, long bone. Any instabilities?
Negative.
All right, same thing for the other leg.
Note a mid-shaft femur fracture.
Mid-shaft femur fracture on the left leg.
Yes.
All right, noted. From here, I'm gonna go ahead and move on to the PMS for the lowers. Pulses. All right, diminished, okay. And equal?
Equal.
Okay. From here, I can't do anything else other than pain stimulus, so I would pinch, she flexions, I would pinch, she flexions. Accepted?
Accepted.
All right. I'm gonna go ahead and inspect the upper extremities. Opposing traction, long bone, joint, long bone, anything?
Note a tip fit, I'm sorry,
Tip fit.
radial ulnar fracture.
Radial ulnar fracture, okay, noted. I'm gonna go ahead and inspect the long bones on her left arm, stable? Or
Stable.
stable? Okay. So from here, I'm gonna go ahead and inspect her PMS bilaterally. There's her pulse. What are pulses?
Absent left side, diminished on right side.
Good. Oh, not good, but consistent. All right, from here I would do pinch, and then I would pinch again. Still flexions, no change in my GCS. All right, so now that I'm done with that, I'm gonna go ahead and cross her arms. On the head's count of 3, we're gonna go ahead and roll her over towards me. 1, 2, 3. From here, I would use my cross-supported hand to visually inspect the back, the buttocks, and the back of the legs. Any findings?
Negative.
All right. I would palpate the back of the spine, starting from the base of the collar that was placed earlier, feeling for each vertebrae, feeling for step-offs. Any irregularities?
No.
Nope. All right, and I'm gonna go ahead and auscultate bilaterally subscapular. Any findings?
Clear.
Clear bilaterally? All right, we're gonna go ahead and roll her onto a backboard at heads count, 1, 2, 3. We're gonna strap her up and put her in the ambulance. All right, so we are en route now. I'm gonna go ahead and get a baseline set of vitals. Let's have blood pressure, pulse, and heart rate. Sorry, heart rate is pulse. Respiration rate and tidal volume.
Respiration is going to be 12 breaths with your partner ventilating.
Right.
Pulse is going to be 48. Blood pressure,
Okay.
I don't know, 98 over 6, 98 over 48.
Okay. So that's pretty good for shock. All right, so 90 over 48. Okay, so cool. I got my.
Because you're a healing touch. Or blood.
I'm just that good. All right, from here I'm gonna go ahead and do my secondary interventions. I'm gonna say that I'm gonna go ahead and at the back of the head, if I can access it while she's on the backboard, put an ice pack. I would go ahead and put a splint on the instability on her right forearm. I would have a partner put a traction splint on the left femur. And I think that was all the secondary injuries. I would go ahead and reassess every 5 minutes because I have an unstable patient. Accepted? All right, I'm gonna go ahead and reassess LOC, GCS, her airway, her breathing, her circulation. I'm gonna reassess her vitals, looking for trends. And I would reassess all of my interventions, including the tourniquet, the splint, possible ice pack, and the traction. And then, is that all of it? Yeah, that's all of it. Okay, cool. That's the end of it, right? Yep, okay. So